Hello, I'm Professor Shane Darker of the National Drug and Alcohol Research Centre at the University of New South Wales, and welcome to our series of lectures on drugs and the body. Today we'll be looking at alcohol, one of the most widely used drugs across the world. The term drug is the appropriate one to use to alcohol. Sometimes there's a distinction made between alcohol and drugs, but it's a false distinction. It's a drug like any other drug is in that it affects the body and the brain. Firstly, what is alcohol? This may sound banal, but it's actually quite important because there's some important distinctions that need to be made. The common ingredient of all alcohol beverages is ethyl alcohol. Now, we should distinguish this from other forms of alcohol, which I will shortly. The effects of ethyl alcohol are, in small doses, it's quite excitatory. In larger doses, it's quite a powerful central nervous system depressant, which has clinically significant implications in overdose. Why do people use alcohol? Well, obviously the acute effects are elevated mood, decreased anxiety, disinhibition. But in high doses, it can cause respiratory depression, impairment of cognitive functioning, and these can have serious impacts on the person's life. You will have often heard the term standard drink when people talk about alcohol and people are trying to keep count of drinks for driving, for example. It varies across countries, but as a rule of thumb, a standard drink contains 10 grams of ethanol or ethyl alcohol. There are a range of different types of alcoholic beverages, of course, some which are drinkable and some of which are deleterious to health. First is alcohol, ethyl alcohol, ethanol. Comes in various forms: beer, ciders, usually about 5% alcohol by volume. Wines, generally about 10 to 15% alcohol by volume. Fortified wines, such as port, 15 to 20% alcohol by volume, roughly. And then spirits, which are the highest concentrations, approximately 40% alcohol by volume. The second category is denatured alcohol. This is ethyl alcohol or ethanol with a bittering agent added to render it distasteful to drink. And what we're talking about here are substances like methylated spirits, also called rectified spirits in some places, used for various industrial purposes. It is not methanol, which I will talk about in a sec. People do drink it. There are cases of people who will overcome the aversion for the bitter taste. I'm talking about people with particularly serious alcohol dependence typically. Finally, there's methanol. This is highly toxic. Methyl alcohol, also known as wood alcohol. This is highly toxic in all doses. It can cause death, blindness. It is to be avoided at all costs. Unfortunately, it can be an unknown substance to people who may be drinking homemade spirits, particularly it's being prominent in third world countries. And it is toxic and to be avoided at all costs. To begin with, let's look at alcohol toxicity. Blood alcohol concentrations of about 0.3 or above grams per 100 mils, which, if you're hearing people talking about blood concentrations, driving might be, the limit might be 0.05. We're talking about 0.3. You start to get major effects: marked respiratory depression, discoordination, disinhibition, somnolence. The toxic level is obviously going to vary depending what people have. At 0.4 or above, This is the concentration we typically see associated with deaths, with alcohol toxicity deaths, alcoholic poisoning. Now, of course, if the other drugs are involved, that can be less, and some people have tolerances that are very high. But if you were to ask me what is the average concentration of deaths that are associated with alcohol toxicity, it'd be 0.4 or above. The signs of acute toxicity, obviously, we've mentioned impaired cognition, discoordination, blackouts. In terms of systemic effects, the most serious effect is respiratory depression. What this means is that alcohol is a central nervous system depressant. Effectively, the brain is forgetting to tell the body to breathe. I'm not certain that people are aware of this, but in the high concentrations, this is the major cause of death, or one of the major causes of death. The other thing to be concerned about in high concentrations is aspiration of vomit. People frequently are nauseous, they vomit, they inhale it, and this is a very serious clinical situation. If someone's very drunk, do not leave them laying on their back. Put them into the recovery position laying on their side, because once people are aspirating vomit, their risk of death is very high. And finally, in high concentrations, people can slip into coma. So what you get is people gradually losing consciousness, ceasing to breathe, possibly aspirating their vomit. I don't think people necessarily aware that the risk of death is very real in high dose alcohol. We tend to associate overdose deaths with drugs such as heroin, whereas in fact alcohol in high doses is highly toxic. Having looked at toxicity, let's move on to look at withdrawal, because alcohol withdrawal is potentially a very dangerous clinical presentation. And it's certainly with someone with severe alcohol dependence who are in withdrawal, this should be medically managed. There's potential for death from seizure, cardiac arrest. So an inpatient detoxification is what is clinically recommended. The onset occurs of withdrawal about 2 to 12 hours after the last consumption of alcohol, and there is an escalation in severity over the next 48 hours. In very severe cases, we can see delirium tremens, the DTs. I'm sure many people have heard that term. Signs and symptoms of the DTs include tremors, hypothermia, that is high body temperature, cardiac arrhythmias, that is an irregular beating of the heart, seizures and delirium. These are clinically important issues that need to be managed because, as I've said, they can result in death. With managed withdrawal, signs and symptoms usually resolve over 3 to 7 days, and indeed up to 14 days if it's particularly severe withdrawal. We've looked at toxicity and withdrawal. Let's move on to looking at some of the effects on major bodily systems. To begin with, we'll look at the heart. In terms of acute effects, alcohol causes hypertension, that is high blood pressure, can cause arrhythmias, irregular heartbeat, and in relation to that, there is a syndrome known as holiday heart syndrome. This comes from the behaviour of people who don't drink necessarily regularly or even very much, going on holidays, vacation, drinking large amounts of alcohol with low tolerance, and it's a documented effect that people can develop cardiac arrhythmias in such circumstances. Just because you're not drinking much at home doesn't mean you can just drink any amount without consequence when on vacation. Alcohol can also cause inflammation of the myocardium, that is of the heart muscle. So these are a range of acute effects. There are, however, chronic effects. One is there's good evidence in chronic use of QT interval elongation. That is an arrhythmia in the heart, and if the rhythm of the heart is affected, and this can cause arrhythmias. The hypertension I mentioned can be systemic with heavy drinkers. They can have continuously high blood pressure, of course, which comes with risk of heart attacks and strokes. Coronary artery disease, clogging of the coronary arteries, which can cause damage to the heart because insufficient blood and oxygen are getting through to the heart and can cause scarring. Left ventricular hypertrophy, that's the left pumping chamber of the heart is thickened, which reduces the pumping efficiency of the heart. And finally, alcoholic dilated cardiomyopathy, that is the heart chambers dilate and again reducing pumping efficiency. So alcohol, while we often think about it in terms of the liver, and we will discuss this shortly, we must bear in mind that alcohol has effects on the heart, and particularly heavy alcohol use, heavy consistent alcohol use and alcohol dependence does have chronic effects upon cardiovascular health. There are also a number of effects upon the brain. The major ones concern, firstly, atrophy of the cerebellum. What this results in is an ataxic gait, that is an uncoordinated gait, difficulty walking. This is a direct neurological effect of alcohol toxicity upon the brain. Dementia. The risk of developing dementia is increased by heavy alcohol consumption, by alcohol use disorder. And if someone is developing dementia, alcohol will accelerate their cognitive decline. Wernicke's encephalopathy. This is a syndrome caused by thiamine deficiency. This is one of the major problems of people with severe alcohol dependence. Alcohol leaches thiamine from the body, and the person quite often has a very poor diet. So what you'll get is thiamine deficiency causing damage to the brain. And this can result in ataxia, confusion, weakness of the eye muscles, double or blurred vision. The syndrome's often called Wernicke's-Korsakoff syndrome because the next development along, if it's not arrested, is Korsakoff syndrome. Korsakoff syndrome is associated with profound short-term and memory loss, resulting in long-term amnesia. That is, the person retains no new information across time. They are damaged in terms of their ability to function, typically would require being in an inpatient institution. They will confabulate, that is, if spoken to, they'll fill in the gaps in the memory with not conscious, but they'll fill it in with fables, so to speak, stories that fill in the gaps in memory. But the important point to know is that this is not a reversible syndrome. And again, what you're talking about here are the long-term effects of alcohol and thiamine deficiency. Finally, stroke. We've talked about hypertension, chronically increased blood pressure. So it's not surprising that heavy alcohol consumption increases the risk of hemorrhagic stroke. Let us now move on to the liver, which I'm sure many viewers will be well aware alcohol is toxic to the liver, and of course in heavy and prolonged use this toxicity will undoubtedly progress in most cases. There are a number of stages in alcohol-related liver disease. The first is the development of steatosis, that is fatty liver. The second is the development of steatohepatitis, that is chronic inflammation of the liver. The effect of this is The next stage is to develop fibrosis, that is scarring of the liver tissue. Finally, in terms of that process, the next stage is cirrhosis, which is basically scar tissue that's extensively replaced the liver tissue, most if not all of the liver tissue. And pathologists talk about a Moroccan leather liver because the look of it is, rather than being pink healthy liver, it looks like old leather. Of course, all of this can result in liver failure. Finally, the risk of a hepatocellular carcinoma, that is liver cancer, is increased greatly by the presence of cirrhosis. Now, I don't want to get the impression across that everyone who drinks is going to develop liver disease. It's not the case, but we do know one of the major damages to people's bodies caused by long-term heavy alcohol use is upon the liver, and this may require liver transplants in some cases, and certainly can result in liver failure and death. While everyone's aware of the effects of alcohol on the liver, I should think, people are probably less aware of the effects and the association of alcohol dependence with the lungs. There are a number of factors associated with heavy alcohol consumption that affect the respiratory system. The first is an acute respiratory distress syndrome. This is severe oxygen deficiency due to inflammation of the alveoli, the air sacs in the lungs. Now, this is not caused directly by alcohol, but it occurs after a pulmonary insult, that is an insult to the lungs and chest. Aspiration of vomit, for example, causes such irritation. Traumatic injury to the chest, and pneumonia. Now, all of these are more likely to occur amongst people with severe alcohol problems. As we talked about before, aspiration of vomit. Injuries are more common amongst people with serious alcohol dependence, and pneumonia is as well. Obviously, an acute pneumonia, aspiration pneumonia, but also infectious pneumonia. They're more likely to occur in people with alcohol dependence, and these things are more likely to develop in alcoholics other than other patients. So you're more likely after these insults to see the development of this distress syndrome. Pneumonia. Now, there's acute pneumonia, which is the result of aspiration of vomit, and that is something that is well documented. But there's also an elevated risk for an infectious pneumonia, community-acquired pneumonia. There's a couple of reasons for this. Firstly, the decreased clearance of pathogens amongst people with heavy alcohol dependence and impaired immunity. Heavy alcohol consumption and conditions such as liver cirrhosis can impair the immune function, meaning the person is more at risk. People with alcohol dependence, heavy alcohol dependence, are typically in poorer health generally than other people, and this can manifest in their lung health. And finally, tuberculosis, and I feel that many people would not be aware of this. There's a substantially higher risk of people with serious alcohol dependence of contracting tuberculosis. It comes from alcohol-induced immunosuppression. As I've said previously, alcohol depresses the immune system, rendering people more open to infection. And of course, there are specific conditions such as liver cirrhosis that impair immune responses. So while people may not think of the lungs when they think of damages associated with alcohol, there are systemic reasons that there are issues that relate to lung function. The effects upon the hypertension that we've seen associated with alcohol can have effects upon organs such as the kidneys as well as upon the heart. Chronic systemic hypertension that we've discussed in relation to alcohol can have a knock-on effect upon the kidneys and cause hypertensive kidney disease. We see hypertensive heart disease. We also see these sorts of disease factors in relation to the kidneys, impairing the functioning of the kidneys. Rhabdomyolysis may also affect the kidneys. In other lectures you'll see that rhabdomyolysis comes up for a number of reasons with other drugs, but in relation to alcohol, we're looking at a loss of circulation while lying on a limb for a prolonged period of time. Persons, if not comatose, highly intoxicated, lying on the limb, cutting off circulation. It's sometimes referred to as crush injury syndrome. So they're unconscious, blood flow to the muscle is substantially reduced or ceased, and the muscle starts to break down. This can release myoglobin, which is toxic to the kidneys and can cause death of kidney cells and acute kidney failure. Finally, there are a range of other alcohol-related conditions that we should briefly discuss. Firstly, cancers. While I think most people are aware of things like alcohol and brain damage or alcohol in the liver, the awareness of the association between heavy alcohol use and cancers is probably less well known. Something like 5% of all cancer deaths are alcohol related, and this covers a range of different types of cancers. There's elevated risk for bowel cancer, breast cancer, liver cancer as we've discussed, lung cancer, pancreatic cancer, esophageal cancer, a whole range of cancers. Clinicians and others need to be aware that alcohol may have very specific effects upon organs such as the liver, but there are broad systemic effects that manifest in a range of different liver and other cancers, and we should be aware of this. There are also a range of digestive diseases associated with heavy alcohol consumption. Acute and chronic pancreatitis, inflammation of the pancreas. This can be exquisitely painful. There's also gastritis, that is inflammation of the lining of the stomach, associated with nausea and vomiting, and there's also chronic diarrhea. These are a range of things that are probably less well known, but like the cancers across different bodily systems need to be borne in mind. And finally, traumatic accident. It will come as no surprise to anyone that the risk of traumatic accident is greatly increased by alcohol intoxication, and I'm thinking here about the operation of machinery, particularly motor vehicle accidents, but also various falls. And 1 in 7 of all injury deaths worldwide are alcohol related. So clinicians need to bear in mind that there are lifestyle factors that can cause injury and death over and above the toxic effects upon the body. In today's presentation, we've covered a wide range of aspects of the effects of alcohol upon the body and the brain. All of these issues are covered in the Pocket Guide to Drugs and Health, a resource that is a page at a glance, typically dot point form, that covers all of the issues we've discussed and may be a valuable reference to you in considering issues relating to alcohol and the body.